Hi. Whenever any child brought with throat pain and fever, it can be due to a viral, bacterial, and on extreme situation, it can be due to diphtheria also. But in our day to day busy practice, is it possible to decode the etiology in our OP practice without doing any investigation? The answer is yes. Today, in this session, we are going to decode the different etiologies of Pharyngitis based on simple clinical questionnaire and physical examination. Welcome to my channel. I am Dr. Sharad Balaji here. Yes. So, for that, what are all the questions that you need to ask? Very simple. You need to just ask some important question. What are all they? What about fever? What about toxicity? Is there any cough? Is there any coryza? Look at the palate for any ulcers and palpate for anterior and posterior group of cervical nodes. Yes. If it is viral pharyngitis, what are all the manifestations it will have? Just remember, when you have a cough, coryza, and palatal ulcer, it is more in favor of a viral pharyngitis. Fever will not be that much high. There will not be any toxicity after giving paracetamol. And you can have an insignificant cervical anterior and posterior group of nodes. I repeat, presence of cough, coryza, and palatal ulcer are in more in favor of a viral pharyngitis. You don't need to give any treatment. Just paracetamol alone is sufficient. Second, but if it is a case of bacterial pharyngitis, remember you will not have any cough, coryza, or palatal ulcer. Presence of cough, coryza, and palatal ulcer literally rules out bacterial pharyngitis. But here, the fever will be high grade, the toxicity will be high grade, and instead of ulcers, you can have palatal petechiae, and you have a significant anterior group of lymph nodes, particularly your jugulodigastric nodes. I repeat, significant fever, significant toxicity, palatal petechiae, anterior group of nodes without any cough and coryza is usually streptococcal pharyngitis unless otherwise proved, for which the treatment of choice is amoxicillin. The third one, what is this? Is it possible to find out Epstein-Barr virus? The answer is yes. The fever will not be that much high. There will not be no toxicity at all. And cough may or may not be there. Definitely there will not be any coryza. But one important finding is palate will contains petechiae just like your streptococcal pharyngitis. But in streptococcal pharyngitis, there will not be any posterior group of lymph nodes, whereas in case of Epstein-Barr virus, you will have both anterior and posterior group of lymph nodes that are significantly increase in size, might be more than 1 centimeter. So I repeat, without any toxicity, without any fever, if your child has throat pain, palatal petechiae with significant anterior nodes and significant posterior nodes, it is more in favor of an Epstein-Barr virus. Is there any treatment for Epstein-Barr virus? The answer is yes. Only when this increase in the size of adenoid and increase in the size of tonsil causing upper airway obstruction, a short course of steroids can be considered. The last one, diphtheria. Remember, in diphtheria, the fever will not be high, but the child is very, very toxic. That is the most important clinical differentiation with respect to other etiologies. Cough may or may not be there, coryza may or may not be there, and on local examination, you can find a membrane in the tonsil. Remember, you will have an edema involving your neck leading to bull neck appearance. So you can't differentiate whether it is an anterior or posterior group of lymph nodes. So I repeat, whenever you have low grade fever but significant toxicity along with the massive edema involving your neck, think in terms of diphtheria. In diphtheria also you can have noisy breathing in the form of stridor or snoring due to the presence of membrane either in the nose or in the larynx. This is how we differentiate clinically in our day-to-day practice. So finally, so this is what we need to practice in our OP busy schedule to differentiate these different four etiologies. And finally, What is the lesson learned? The lesson learned is very simple. Whenever any child presents with fever along with throat pain, cough and coryza is more in favor of viral. So reassurance is required. Whenever you have a high grade fever along with the toxicity without any cough, coryza and palatal ulcer, but with palatal petechiae, it is more in favor of streptococcal pharyngitis requiring amoxicillin. Whereas a non-toxic child with significant anterior group of nodes, posterior group of nodes along with the palatal petechiae is your infectious mononucleosis unless otherwise proved. Steroids are indicated only when there is a significant upper airway obstruction in the form of severe recent onset snoring or odynophagia, not able to swallow. And finally, without any high grade fever, if you have a significant toxicity along with the edema involving the neck, think in terms of diphtheria, and here the drug of choice is anti-diphtheria serum rather than your antibiotic. Thanks for your patient listening. Bye bye.